Is there a connection between hip impingement and pelvic instability? Hello, this is Dr. Siddharth Damber, physician here at Chicago Arthritis and Regenerative Medicine, expert in rheumatology and regenerative medicine. Interesting question I heard recently. Someone who has hip impingement symptoms and mentions that they initially had some pelvic instability before that hip impingement started. So what is impingement? Impingement means that you have a space in the body that normally there's some kind of normal movement, and for whatever reason, now that is being constricted. That constriction can come from a lot of different reasons. One of those reasons could be, let's say you have a big bone spur somewhere there. Another could be if there is fluid in an area that shouldn't be there. And of course, another one could be if there's instability. Instability is an interesting one. And the reason why is because that might be actually what's causing a bone spur eventually to develop there. And it could also be why there's fluid in that place as well. Let's discuss. So when you talk about hip impingement, the most common type of hip impingement that people hear about nowadays is femoral acetabular impingement. And what that means is that the normal movement of the femoral head in the hip joint, of the femoral head around the acetabulum, is getting pinched. There are a lot of hip surgeons that feel that the treatment for that is surgical, that they can go in and shave a little bump that may be causing that kind of impingement. Is that the best way to treat this? Most surgeons will obviously say start with conservative measures, namely do some physical therapy, some strengthening. If there is some instability, maybe it gets better, maybe things stabilize, maybe that impingement lessens. Maybe a steroid injection to help reduce some pain and inflammation there. Maybe that takes away symptoms. Comment that I saw on social media was somebody saying that they had some instability in the back of their hip or in their pelvic area, and now they had hip impingement. So what's the connection there? My understanding for impingement is that there's some kind of instability that's driving that impingement. So in this example, let's say in the hip, it could be if you've strained a ligament around the hip. So let's say you had an overstretch injury, right? You're in some kind of activity or you're rushing to get somewhere. You've accidentally kind of overstretched your hip and it's now loosened one of the ligaments. You know, after a few days or a week, some of that initial discomfort kind of lessens. But let's say 6 months later, you're noticing there's a little bit of kind of chronic ache now in the hip, and now there's a little bit less range of motion. You get some imaging done, and maybe there's a little bit of arthritic changes, or maybe you've been told there's a little bit of bone spurring there, and people start talking about hip impingement. In this case, the normal stability and movement of the hip joint has been impaired, and the reason why is because the ligaments, which are meant to hold the hip joint together, have been slightly overstretched, and now instead of having a good controlled motion as the hip joint is moving, now there's a little bit more friction because of that instability, because the ligaments are weaker. So one thing that can happen in that kind of scenario is that your body, when there is instability and it's not being handled or repairing on its own, the body will frequently put calcification into that tissue, ligament, tendon, and that's frequently why you'll end up seeing bone spurs. In this case, the problem primarily is instability. And if you can treat the instability, then things will get better. Instability will get better, and stability will improve, and pain will improve as well. And hopefully range of motion gets better also. Something I've talked about in the past and something that kind of comes up from patients is, well, what do you do with that bone spur there? It can be a little bit tricky. And the reason why is if the bone spur is large and if it's directly causing impingement, then there may be some benefit to actually removing that. But in most cases, that's not necessary. In most cases, it's a matter of improving the stability of the tissue that's been weakened. And in this case, we're talking about ligaments. And that could be by injecting something like prolotherapy or PRP into the ligaments to help strengthen them. so that there's more stability as the joint is moving through that range of motion. Another way that kind of instability can develop is if you have a strain of, let's say, the sacroiliac ligaments. So the SI ligaments are basically the ligaments over the back of the pelvis, and they are a very large area, frequently injured, can drive a lot of lower back and hip pain as well. One of the things that can happen if you've strained the SI ligaments, and that strain can happen from, let's say, lifting, let's say some normal activity. Certainly you see a lot of that in women post-pregnancy as well. Just as the SI ligaments have been stretched out, there can be some instability there as well. But one of the things that can happen is as that pelvic ligament or as the back of the hip ligament, the SI ligaments have been overstretched, it can then put more strain on the surrounding tissue, and that can include in the hip as well. And it can throw off some of the movement and the normal function of the hip, which can then lead to other problems and then eventually hip impingement as well. So frequently, if someone has, let's say, early or mild or no arthritis of the hip joint, but they're developing pain, they've got this kind of story where they're saying that they've kind of overstretched some of their SI ligaments. Now they've got a little bit of discomfort there, but more pain in the hip, and now some kind of reduced range of motion, assuming that there isn't like severe arthritis in the hip joint, then if they fail physical therapy, then something like prolotherapy or PRP can be useful, treating both the hip joint, the hip ligaments, and the SI ligaments as well to overall improve stability, to give a better functioning joint, and in this case, try to help treat the hip impingement as well. Hope that was helpful. Any questions, let me know. If you have hip impingement, hip pain, and it's something that you need additional assistance with, give us a call to Chicago Arthritis, and we're here to help. Until next time, have a good day and live well. Bye-bye.